really delighted that I have this opportunity to present to you all, and as it's already been said, I work in Temple Street, Crumlin, and the Rotunda, and I am by no means an expert in this area, but I have an interest in it, and I think it's something that we can do better. We're doing well, but we can definitely do better and provide a better service to the children of Ireland. So I don't know if you can go on to the next slide, David. Sorry, this is going to be very... Next slide, please. So I'm just going to... The talk is just going to be very simple, and it's just where we are now with CVI in CHI Ireland, and then just take you through what a normal eye exam is. I think it can be quite confusing because there's so many different people involved, and our physical footprint in space in the Children's Hospital, it can, it's very difficult to know who's coming and what their job is. I'm just going to go through that. There was some videos in the talk, but I've had to take them out. So there's some photographs, and that will hopefully be helpful. And then the conditions associated with CVI, and the CVI 5, which is just something that every ophthalmologist should be thinking about. And then the complexity of making a diagnosis of CVI, and then where we are now and where we would really like to go, and how are we going to get there with CVI in Ireland. So if you just move on to the next slide, thanks very much. So this is the pediatric ophthalmology book, and it's like our Bible. It's a big, heavy book. Sometimes I get children to sit on it when they can't reach the slit lamp. It's a really big book. It's over 1,000 pages. But in this, less than 20 pages are dedicated to topics around CVI. So that just shows you how much more we need to highlight this condition within not only pediatric ophthalmology, but ophthalmology as a whole. So in the book, the Pediatric Ophthalmology Bible, it's 25, it's less than 20 pages. And then the next slide, please. So in Ireland, CVI is the most common cause of visual impairment in childhood, and Hilary, the eye care liaison officer for children, tells me that it's also her most common reason for referral. And the more it's being highlighted and understood, we think that about 1 in 30 children could be affected by it. And that means that one child in every classroom potentially could have CVI. So something that we do need to really put more emphasis on and educate everyone about. So the next slide, please. Sorry.
We lost Sarah.
Oh, hi. Can you hear me again?
Yeah, you're back. Yeah.
Yeah. So if we just go on to the next slide, then.
Yeah, I'm not sure if it has not updated at your end, but I went past the one for Belfast, and I'm on the next one after that.
Perfect. Oh, no. So anyway, I did my training in Belfast with Sonia George, who has a fantastic clinic called the Novak Clinic. It's an award-winning clinic, and it happens a few times a year, where a pediatrician, an occupational therapist, an orthoptist, an optometrist, the eye care liaison officer, they all are in one room together. Obviously now they do it in a really big room. I'm not sure actually with COVID and social distancing how they do it, but and they all came up with a plan for each individual child that they saw. And we went up to visit that clinic, and it was just so amazing, the amount of resources that were available. So that's ideally where we'd like to get to, but we're not there yet. And also having trained with Sonia, she really inspired me about how important this condition is and how we can help. And so what I've learned since I've been a consultant is that I learn something from each child with CVI that I meet and their family, and I'm being educated and taught something with each interaction that I have, and that things can change. So one child who can can be going fine and there's no worries, and then they move on to the, in primary school, they suddenly have a lot more homework or a lot more reading, and then a problem can become apparent. So things can change, nothing is static. And also that each one of the children is different. So you have to take that into account with each one that you're missing. Each has their own specific background, their own situation that they're in, and you have to take that into account. And then that the parents of the child know the child best, and you must listen to them because they will give you the answer. So the next slide, please. So when you come to the eye clinic, especially, and I'm going to talk more about Temple Street, it's a very small space. It's a very crowded space. And now with the things for coronavirus, everyone has masks, and it's a very intimidating place for any child to come to, but especially one with CVI. So when you come in the door, you meet the administration staff, who are our bedrock, and they book you into the clinic. And then you may meet one of our specialist nurses. One of our specialist nurses, Noreen, is particularly interested in CVI, and they may take a small history, check some visions, and they are all now trained to be watching out for the features of CVI in the history and in the child. The next person you may meet is the orthoptist, who's an allied healthcare professional who's specialised in assessing children's vision, and they have many techniques for doing that. Also within our team is the optometrists, who are fantastic at refractions, but also they have very specialist interests like contact lenses. And one of the optometrists has set up a special needs clinic, particularly for children with autism in Grangegorman. So they're a huge asset to us. Then the other people in the clinic are ophthalmologists in training. So these are doctors who may have 10 years training as an ophthalmologist, so can be very experienced ophthalmologists, and then the consultant ophthalmologist. And then over the last, I suppose it's about over 2 years, we've had Hilary, our eye care liaison officer, who sits in some of our clinics and who is always available on the phone. And she is really the link from the hospital then out to the community services. So how do we examine the children in the clinic? So really it starts from the moment we call the child in. We're observing how the child moves and interacts. Are their eyes steady, central and maintained? So are the eyes straight? We usually use a light source just to look and see, are the eyes straight in primary position? Is one of the eyes turning in? Is one of the eyes turning out? And we do a cover-uncover test, looking for manifest or latent squints. So that's part of the assessment. Then the next thing is looking, are the eyes steady? Do they have an abnormal movement? Are they moving back and forth, up and down? Are they, is there more a roving type picture? So again, we're looking to see if the eyes are steady. And then the next slide is the vision maintained. Can the child fix and follow? And we usually do this with both eyes open and then with each eye individually. Again, this can be to different targets, especially with smaller children. It may be looking at our faces, looking at a bright light source. And so this is another part of our assessment. This was just a video I took out as part of the technical difficulty, but again, it just is demonstrating how getting the child with one eye coverage to follow a small light source. We have other ways of testing vision. There's an ophthalmologist in Bradford called Rachel Pilling, who's developed this Bradford visual function box, which is the first photograph that you can see there. And these items have been calibrated to represent a certain level of vision. So for children who find having eyes covered and who other visual function tests are not appropriate, it may be even letting them play with the toys from this box be a way of getting some assessment of what they can see. The next pictures are of Cardiff cards, which are a preferential looking test. So we, as the pictures get smaller, the resolution or the amount of vision equivalent to that gets higher. So the first cards have a very stark contrast, and then as they go down, the contrast gets less and less. And we're looking to see, does the child look at the image on the card, so looks up or down. And then the next mode that we use for older children will be case pictures, where they can either match the pictures and with a little card in front of them if they're not confident enough to speak out, and that can work for very young children. And it's also something then that we can give parents a copy of the pictures, and they can go home and practice and then come back the next time for their vision assessment. And then moving on to the Snellen and Logmar, which uses letters, which we all would be familiar with. So then after we've done our assessment of vision, eye movements, looking for squints, we examine the eyes. So starting at the front, looking at the eyelids, the conjunctiva, the cornea, which is the clear window into the eye, the red reflex. And then we usually use drops to dilate the pupils. And this can be quite traumatic for children who are already, have done a lot of work having their vision assessed, and they have to get eye drops. And the thing about the eye drops is then you have to wait 20, 30 minutes for them to work, sometimes longer, sometimes they need to be repeated. So this does make a trip to the eye clinic stressful for children with normal vision, and very stressful for children with CVI. So once we've had the dilating drops work, then we use, depending on the age of the child, we use this hat with a bright light source and a lens to look at the back of the eye, to look at the structure of the eye. And then we use magnifying lenses to work out the glasses prescription for the child. So then these photographs just show how we assess for visual field defect, and sometimes you use a second person to bring the peripheral object that you're looking for into view. But this allows us, and in adults, obviously, we use a very formal, a repeatable test called a Humphreys visual field or an octopus visual field. But in children, obviously, we can't do that. So it is more a gross test, but it's something that, with particularly if you work on it and it's reproducible, you can get the children to comply very well with looking at their visual fields. So when we've done all that, and a lot of children with CVI, you can find that they don't have a significant refractive error. Their eyes look very healthy, but you don't have an explanation for the visual problem that they have, and especially if there is a history of a congenital or an acquired disorder of the central nervous system, we must be thinking about CVI. So particular things that we watch out for is malformation of the brain in utero, an event around the time of birth, particularly in premature infants, and especially those born less than 32 weeks or 1,500 grams, because they are particularly at risk of developing conditions of the brain to do with blood flow, PVL and interventricular hemorrhage. And then in infants who may have had deprivation of oxygen at birth, children who have, brain injuries, for example, car accidents, road traffic accidents, injuries with bicycles, that sort of thing, infections like meningitis, particular metabolic disorders, and rare forms of epilepsy. So when you have this in the history, you must be thinking about CVI, especially when you've done your examination and you haven't found a cause within the eyes to explain the CVI, the visual function. So we must think about cortical visual impairment. And for those parents who have been on their CVI journey for some time, everyone will know Gordon Dutton, who is a paediatric ophthalmologist who works in Glasgow and who spent most of his career working on this and has published extensive papers. He's just fantastic in this area. So we, especially as paediatric ophthalmologists, we normally look to his work to guide us in this area. So when you have an eye exam that does not explain the individual's functional vision, a history which puts them at risk, and then the presence of certain visual or behavioural characteristics. So common characteristics would be their colour preference, particularly black and white and yellow and red, a need for movement, either the object that they're viewing, that the children move that, or they move themselves, a delay in visualizing something, particularly something new. So it may take them, a long time to actually look at something new presented to them. Visual field defects, particularly the inferior visual field, difficulty with complex scenes, need for bright light or looking for prolonged periods of bright light, difficulty with looking at things in the distance, atypical visual reflexes. For example, when we put in eye drops, usually most children, really, whenever you go close to their eyes to put in an eye drop, they close their eyes so tight, whereas children with CVI may not. Difficulty with looking at new things, and an absence of a visually guided reach. And so if there's a suspicion of CVI, these are we call these the CVI 5, they're screening questions, but they really fit with older children. So, and children who are mobile. So does your child have difficulty walking downstairs? Do they have difficulty seeing things that are moving quickly, such as small animals? Does your child have difficulty seeing something that is pointed out at a distance? Does your child have difficulty locating an item of clothing in a pile of clothes? Does your child find copying words or drawings time-consuming and difficult? So these are really screening questions. And so if there is something on this, and it doesn't have to be all of them, it may be some of them, but if there is something that's highlighted here and characteristics, then you'll be moving forward towards making the diagnosis of CVI. And so depending on the history, we move on then to do investigations. So that usually a lot of the children would have had a lot of these done already, but imaging of the brain, such as an MRI or electrophysiology, testing the optic nerves and the retina. So this is a test that is done by, which is done in Temple Street, and little electrodes are placed around the eyes and on the back of the scalp, and different patterns are shown to the child, and then an electrical signal is generated, and a printout is generated from that, and then you can interpret how the different cells and the optic nerve is functioning. And then obviously communicating with other clinicians, because a lot of these children will have multiple clinicians involved in their care, and so it's important to link in with them, particularly the developmental pediatricians who may be looking after them. So in an ideal world, I think every child who has a query diagnosis of CVI or a diagnosis of CVI would get to attend a NOVAC style clinic, like the Belfast clinic, with a multidisciplinary team. But we're not there yet. So, as I'm sure you're all aware, even before the cyber attack, even before coronavirus, ophthalmology had the largest number of children waiting for an outpatient's appointment in CHI. And so we're severely under pressure for, there's long waiting times for everybody. And so we're just trying to use the resources that we have as best we can to help as many people as we can, or as many children as we can. So we are working on it. We're raising awareness, and particularly working with the paediatricians. Last month, the grand rounds for paediatrics the topic was CVI, and I spoke at that. They presented a paper about the prevalence. So it is being raised within, we're raising the profile, and I'm working particularly with one of the paediatricians called Erwin Gill. And so we have a wish list, and the number one on both our wish lists is that by the end of the year that we will have managed to have one joint clinic together. And the idea of the clinic is that the children would come, have an assessment, maybe have some recommendations made. At the moment, we're using a questionnaire before they come just to the ordinary ophthalmology clinic. And then, they may already be in touch with services, but to make some recommendations, and then to link back in once more, maybe even via phone call, to see how things are going. We're not there. We have a way to go. So at the moment, what we're doing is when we have a diagnosis of query CVIs, we're using a questionnaire which was developed by Gordon Dutton, and it has, I think, 51 questions, all around specific symptoms or characteristics of CVI, to do with lower field defect, unilateral field defect, seeing moving things, picking things out when there's a lot to see, moving hands and feet in space, and seeing where the hands and feet are, to do with attention. For example, if a child with CVI may, when they really want to look at something, it may be very important that there isn't any noise distraction, also that they can get very tired when they're doing complex visual tasks, things around behavior and recognition. And so we're using this questionnaire, and Noreen, our specialist nurse, then generates from the questionnaire some recommendations. But what we say about the recommendations is take what applies to your child and leave what doesn't. It's just some suggestions. And that's how we're managing things at the moment. And so my feeling about it is it's key to make the diagnosis of CVI so as soon as we can, so that the child can have individual adjustments and interventions in place so that they can achieve everything possible in their education particularly, and then in their day-to-day life. And a lot of the adjustments, parents are already doing, the things because they know their child so well. They know, look, my son doesn't do so well when the environment is very cluttered. So we have, we only play with one toy at a time, or we've put markers when the floor changes from wood to tile, because he always found that very difficult. We don't move the furniture around in the house. So a lot of the things parents are doing instinctively. And then once the diagnosis of CVI is in place, the children most likely will still need assessment every 6 months or every year to monitor squints, or to check for glasses, particularly up until the age of 7 when vision is still developing. But really all the progress and the work is being done at home in school with regards to the CVI. And then, so I normally, especially when you're having your first consultation, I normally just try to pick 3 things to work on, and you know, just start from there. But by the time you have a second interaction with the child or the family, actually they have, you know, the family and the child have moved on so far, especially with the supports that they get. So they are experts and moving things forward, and I'm just there to get the ball rolling, to get things started. So I hope that was helpful. I'm sorry I had the videos, just the technical difficulties didn't work, but was many thanks. And if there's any questions or suggestions, I'd be more than happy to answer them. And this is, you know, a photograph of our eye care liaison officer, Hilary, and she is really the key and the centre of everything, because we can, once we make the diagnosis, then she puts her arms out to the community, and then the supports are in place there. But it also works the other way. So if there's somebody in the community that, you know, there's something someone's worried about or something has changed, then it works the other way. So the flow comes back into the hospital as well. So we are really delighted to have NCBI and the eye care liaison officer in the hospitals with us, helping us support, and then all the work that goes on in the community is just fantastic. Okay, thank you.
Thanks very much, Sarah. There's one slide at the end. I'll just pop it up for a second, maybe.
Yeah, no, it's okay. That's just if somebody has a question about it, it's okay. Don't worry about the dorsal and ventral streams. Don't worry about that.
Okay, no problem. So
that's great, Sarah. Thank you so much for that. That was so interesting for everyone, I think. We have a couple of questions, I see.
Sure.
Okay, so we have a question from Angela asking if a child was diagnosed through NCBI and neuropsychology a number of years ago and attends an ophthalmologist in the private clinic, can they still access a clinic that looks more at CVI?
Would you mind just repeating that question again?
Yeah, so it's if a child has been diagnosed through neuropsychology and is linked in with NCBI a few years ago and is seeing an ophthalmologist, can they access a clinic that looks more, I suppose, specifically at CVI as well?
I suppose if the ophthalmologist that looks after them privately has already made the diagnosis and they're getting the support that they need in the community, I'm not sure that, and their eyes are being monitored for glasses and squints, I don't think, I'm not sure there's much that we could add really, because really we're here to help make the diagnosis, and if there's a change or a problem, to help, but really the hard work takes place in school and at home. So, but, you know, if there's any problems, of course, anyone can be referred into Temple Street or Crumlin. That's not any problem.
Okay, thank you. Just looking through here, I think you've answered that as well from Karina. Can anyone in the country get a referral to Dr. Chamney's team? So I think that would refer to, could you ask specifically to be referred up to you, or is there a particular pathway?
Anyone can write a letter to Temple Street, and like I said, we're hoping to set up this a joint clinic, but yeah, anyone can, their pediatrician can write a letter, or their ophthalmologist can write a letter, and they can come to the clinic in Temple Street. But we don't have the beautiful clinic yet set up. We're far away. You know, we're not far away, but we're not there yet. And it's all sort of still in development, how we set up our pathways and our flow. But I suppose we're starting, and so that's the message, really.
That's great, thank you. And we have a question from Jolene. asking if there's no history known to be related to CVI, but characteristics point to it, can it still be diagnosed, or must there be a link to a cause?
So, I mean, in that case, then I would ask for some imaging of the brain. So if the eyes look healthy, but yet they're, the characteristics are strong and, there is a definite worry about it, I would organize an MRI scan. And depending on the age of the child, if they're, if they're young, they may need to have a general anesthetic to have that scan because they need to be very still. I would request an MRI and electrophysiology and then take it from there. If there was any other worries about any other areas of development, then I would ask that they were seen by a developmental pediatrician. So, if there's a definite history, that obviously makes things much easier. But if there isn't, then you need to look with these investigations, and with the support of my pediatric colleagues.
Okay, we have so many questions coming through here, guys, and I don't know if we're going to get time to go through them all. I'm wondering, Sarah, if we were to follow up with you maybe later and ask some of these questions and get back to people, is that doable? I'm just conscious of the time. Yeah, because I just don't want to leave anyone not having a question answered, but I'm also just conscious of the time. But we'll try look at some more here. Can anyone attend the Belfast Novic Clinic privately? Do you get a referral through your GP, or do you contact them directly?
I'm afraid not. That clinic is an NHS clinic, so you would need an NHS number and to live in Northern Ireland. And so, and Sonia doesn't work privately as far as I know. So it's an NHS clinic. So you can't attend it privately.
Okay.
But we should. Well, hopefully we'll have one. But who knows how long it will take? It might take some time. But like I said, the end of this year was our goal, so we're working on it.
I know, and it's great to see all the progress, and all the work that is going on in the background now, trying to move things forward and get access to clinics, and it's really great to see it happening.
When I applied for a job here, and like I said, I've done all my training in the NHS, so I'm really an NHS type person. But the one thing that kept coming back was CVI, and although everyone who is here is working so hard at so many different things, it was just that maybe that connected thing with the multidisciplinary team that we're missing. But we're working on it, and the connections are there. They're not happening all at the same time, but the connections are there.
Okay.
So we go on, Lisa. I think, like with all the questions, is brilliant. But like that, Sarah, if we can come back to you and get back to the people that are asking the questions. I'm just conscious of the time that we need to try and stick to our schedule, because we have lots of others to fit in. So is that okay, guys? So we'll come back to you guys, if that's okay with you, Sarah, if we can maybe follow up with the rest of those questions after or later on.
Yeah, could I maybe suggest that anyone who has put a question up and we haven't been able to get around to today, if they could email the question into us, just to make sure that we get them all. So you can email into lisa.marshall, and that's ncbi.ie. Or you would have had an email from Margaret with details of the conference. You can send the email to Margaret with your question as well, just to make sure that we're not missing out on anyone's questions.
Yeah, brilliant.
Sarah, thank you again so much for that. It was really enjoyable and really, really informative. We really appreciate you coming on today.
Yeah. Thanks so much, Sarah. It's been brilliant.
Okay, so I think we're going to move on now to our next guest speaker. I want to really thank Martina Keane for joining us today. So Martina is going to speak about her experiences as a parent of a child with a vision impairment. So I'll turn over to you, Martina. Thank you.
I'm just going to mute everybody here, and then Martina, if you would unmute after I mute everybody. Thanks. Okay, so you can unmute yourself there now, Martina, and we'll get on.
Okay, hello everyone. My name is Martina Keane, and I am the mother of a wonderful little boy. Our son Peter was born premature by an emergency section for reduced fetal movement. He is now 8.5 years old. Peter suffered an intracranial bleed associated with vision impairment and delayed development. From early months, it became obvious that Peter was not fixing and following, and we were referred to the ophthalmology department in Crumlin for an assessment. Sorry, I have a cold, so excuse me. Peter received a normal eye examination from the ophthalmologist, but Peter's sight had not developed. The explanation given when queried was that Peter's visual problems were secondary to his neurological issues. Peter was also referred to our early intervention team, where he was given access to physiotherapy, occupational therapy, and speech and language therapy. We have had numerous appointments with each discipline and met some people who have given good advice and guidance over the years. Our early experience of the team showed some lack of understanding of cortical visual impairment, and this left us feeling frustrated at times. Living in a rural area, the team would not have encountered many children with Peter's complications. To us as parents, the explanation given in Crumlin was not a diagnosis, and we turned to the NCBI for assistance. Edel O'Connell from NCBI arranged a functional visual assessment to be carried out on Peter, and it was at this point that we first heard cortical visual impairment. Our journey to understand CVI commenced, and that learning curve is still ongoing. The CVI assessment gave us some useful observations and a basis on where to start working with Peter. The one important piece of advice I could give to a parent of a child with CVI is whatever you have to do to get that child to use their limited vision, even if it's only for a few seconds starting off, as the more they do, the greater the chance they have that their sight will develop. This has definitely been the case with Peter, and we are still seeing improvements in how Peter uses his sight. Our first attempts to engage Peter's sight included using a blackout tint. Every morning, myself and Peter would use items like a light-up Christmas Santa, a disco ball, bright red shiny beads, a bright red helium balloon, and shine a UV light on these. An object moving in the early days with Peter attracted more notice, so I would slowly start from his right side, as this was the side we felt his visual field worked best. The aim was to attract Peter's attention, to get him to track the item and turn his head to follow. This was at a very close range of less than 1 foot from Peter's face. Peter moved on to reach out to touch the object, and this gave us great encouragement to continue. We learned that a black background on which to display items to Peter worked best. We covered the tabletop of Peter's high chair black. We put black mats on our floor, and we used large black cards to hold behind items that we wanted Peter to find. Over his changing table, I made up cards with a black background and used red and white cards to create patterns and changed these every so often to see would he notice. Over his cot, we changed his mobile. We asked Cow and Gate to send us a few small black and white cows, and they were very kind to agree. We tied red pipe cleaners around his bottle, and we used a red spoon and bowl to feed Peter from. I wore sunglasses with shiny bright studs on the top of them, and I found the brightest red lipstick I could find. In the early days with Peter, he found mirrors very hard to look at and faces very complex, and both of these are fine now. He overreached for items he wished to pick up, and it was like a sweeping motion to locate what he wanted. Again, this has improved to most of the time being exact in finding and picking up what he wants. LED balloons worked great for Peter. When he was around 3 years old, we would use them at night when the lights were turned off and watch him find and locate the balloon and pick it up. Peter relied a lot on his hearing to locate things. He had most interest in noisy toys. We would turn on a toy, get his attention, then turn it off, and watch to see him having to use his sight to find it, and then turn it on as a reward. Again, making him use his sight first and his other senses second was another step to improving his vision. We attended the CVI UK Convention 2015 in Sussex. It was an amazing experience to be in a room with so many people who had great knowledge on the subject of CVI. It was our first time to hear Gordon Dutton speak, and he explained how, in some cases with babies, the brain develops new pathways and how the brain is at its most plastic from 0 to 3, but there is still potential thereafter. As Peter was a baby when he suffered the bleed, his brain was still developing. In 2015, we approached Child Vision for an assessment of Peter with the hope of a place within the preschool. Peter started preschool in early 2016, and as a family, we finally felt we had found a place where Peter's challenges were understood. There are amazing services and facilities within Child Vision to develop each child's abilities. It was here we learned so much about how to help Peter and met so many wonderful parents and staff. To have so many people who understood visual loss working together to develop each child. Peter learned here how to cope with the world around him and reduce his fears and make new challenges less daunting. I only wish we lived closer to Child Vision. The travel distance makes access to these wonderful services so difficult. When Peter finished preschool in Child Vision and progressed on to primary school, we decided to try a split placement between St. Joseph's Primary School in Drumcondra for the visually impaired and St. Michael's Primary School in Castlereagh, County Roscommon. Peter's health issues together with the travel became too much for us, and we now attend St. Michael's School full-time. We visited many schools before Peter was due to commence his primary education. From our first step inside the door at St. Michael's, we were made to feel so welcome. It's a tough decision each parent has to make to find a suitable school. How your child will adjust to their new surroundings and how the school will adjust to their new recruit. In our case at St. Michael's, nothing was a challenge, and we are forever grateful for the efforts staff has made to help Peter feel comfortable and settle in. Peter has access to the service of the visiting teacher for the visually impaired. Over the last few months, a new teacher has taken on this role in Peter's life and has helped his teacher at St. Michael's put together a visual programme for Peter, which is working very well. The service until recently was somewhat missing from Peter. As I understand, the area covered by each teacher is very large. We are hopeful now that we will receive greater assistance in the future. I'm going to conclude with a question. Is CVI permanent? CVI is not completely curable, but there is so much that can be done to improve your child's functioning sight. Peter is still a work in progress, but has gone from a baby who I felt knew the difference between day and night and would stare at ceiling lights, the bigger the better and the brighter, to today where he uses his sight to find his way around, looks at pictures to identify the object shown, can tell me colours from cards, and is starting to recognise his numbers and letters. I'm Peter's mother, and we are still working on identifying exactly what Peter sees, and we also have a developmental delay with speech to deal with. But as one special little lady said to me, you never give up. Thank you very much.
Martina, thank you so much for that, and for sharing that with us. There was just so much, and such a positive story as well.
Thank you.
If anybody has any questions for Martina and they want to pop it into the chat, that would be great. I think what came across really strongly there, Martina, is about, you know, how much understanding your child's vision and how individual children with CVI are.
They are completely different, and that's it. But as I said, you could take something today and try it. It won't work.
Absolutely.
Put it away, take it out again, even in 6 weeks, try it again, you'd be surprised. And another thing I didn't say there, as I said, some children don't have communication skills or limited communication skills. And I know when Peter was very small, that was the case. And you'd be trying something with him and you'd be getting no response. But one thing he used to love doing was lying on his back and kicking his legs constantly. And if you were trying to do something with him, it was amazing to see that the kicking had stopped. And it's a case of he actually was taking note, even though you didn't see his eyes moving, but he actually was taking note. But there's only small little things, some small little things parents know that their kids do, and they might pick up on it. You know, it's just, and again, it's only trial and error.
I know. And I think, you know, as parents, you guys are the professionals, because it's all those small things building the picture of how your child sees. That's just so important.
Yes, indeed.
Okay, I'm just checking here. Lots of comments here, Martina, just thanking you so much for coming in and sharing this.
Perfect.
I just checking. I just don't want to make. Thank you for sharing, and well done on being so proactive. It's come in from Avril, which is lovely. Okay, so I think that's it. So
Perfect.
yeah, Martina, thank you again so much. I hope you're going to stay on, and
I'm finding it very interesting.
You can sit back now and relax a bit.
Perfect. Thank you very much,
Martina. That was brilliant.
Martina, take care.
That's
okay.
brilliant.
Okay.
Right.
Okay, so we're just coming up to 20 past. Okay, so guys, will we take time to have a bit of a stretch and grab a coffee or something?
Yeah, so that sounds good, Lisa. So if we take about 15 minutes, so if we come back maybe at 25 to, because we're finishing just 5 minutes earlier, and we'll get going,
I'll leave this meeting room open. I don't think there's any point in putting you back into breakout rooms for the break, is there, unless we want to go?
I think we'd stay here, Dang, and if people just want to keep off their camera and their mute and go and get a coffee like that, and just come back and join in about 15 minutes, we'll start off again. So guys, I'm going to introduce our next speaker, which is Dr. Emma McConnell. So Emma is a research optometrist at the Ulster University. Her research interests include pediatric vision and the provision of eye care for children with special educational needs. And she has experience also of providing practical supports to parents and teachers of children with CVI. So with that, I'm delighted to pass you over to Emma. Hi, Emma.
You're on mute there, Emma.
On mute, Emma.
Sorry. Hi, everyone.
Thanks, Emma.
So thanks very much for today, and thanks for the speakers this morning. They've been great. It's been really interesting. So hopefully there's been some useful stuff for parents as well. So I'm going to turn my camera off for my presentation, and I'm not sure my internet can cope with everything. So I'll hopefully share my screen just in a second.
That's perfect, Emma. Yeah, we've got that there.
Okay, can you just see my slides at the moment, or can you present your view?
Yeah, we've the first slide up, but it's kind of split screen. The next slide is in preview mode. Yeah.
Let's see. Is that there?
we still,
let's see.
yeah, we still have just kind of the preview, the first slide there, and the next slide, and then we can see miniature previews of all the other slides at the very bottom of the screen there. But it's okay. I think it's not too bad.
Probably swap
Probably don't want to
displays.
see no. How do you do that?
Put
It's
your
the
mouse
third
on
option at
swap
the top left.
displays.
What? Sorry.
Put your
Okay,
mouse
that's-
up at the top under swap display, and it should give you a drop down.
Well, you have to click swap displays again to go back.
Hold on. I can't even find Teams. There we are. Hold on a wee second. I'm just going to stop sharing and go back into it and see. Let's see. So if I do this, what
There
can
we
you
go.
see
That's
the,
perfect,
is
Emma.
the slide?
That's
it now?
perfect.
Okay, great. Super. Okay. Yes, so my name is Dr. Emma McConnell, and as Jane's already said, I'm a research optometrist and I work at Ulster University, Queen's University, and then the Belfast Trust. So the main thing I'm going to focus on today is just talking about some of the problems that children with CVI might experience, and then just some practical strategies that you might be able to implement at home or at school to try and help your child if they have any of these problems. But just before we do that, I know Sarah this morning has touched on this a bit, but I'm just going to give a little brief overview of how we see normally, just because I think it adds a bit of context to some of the problems that you might experience with CVI. So the slide here shows if you were to take like a cross section through your brain, basically. So at the front here, this shows you your eyes, and basically whenever we view an object out here in the world, there's visual signals which pass along through this pathway here before finishing up at this part of the brain at the back here in the occipital lobe of your brain. So then from that point, visual information is then sent to various different parts of the brain to determine, to determine what we are supposed to do with the information that we're looking at. So you might have heard of the terms ventral stream and dorsal stream used before. So they're used quite a lot when talking about CVI, and that's basically just two streams that visual information goes to, and each of them are responsible for different functions. So the ventral stream, it's whenever we look at something and we recognize the object, we're using information in the ventral stream. The dorsal stream would be for things like how to interact with something. So how, if we were to view an object, how would we know how to pick that object up, or how would we navigate through a room? Or how would we try and find something if there's a really busy or crowded environment? So things like that, we do it without thinking, but it's the dorsal part of our visual pathway that we're using to determine that information. So then this is a little diagram which Gordon Dutton has developed, which I think it just explains things quite nicely. So this part at the bottom is just kind of the visual pathway in the eye and through the brain. And then beyond that, it splits into the ventral and dorsal stream. These bits are quite nice at just trying to explain the separation between those two different pathways and what each of them are responsible for. Because that was quite just a nice little schematic to try and explain that. So that's a bit of a whirlwind tour. I know a lot of you probably know all of that stuff already. Some of you might not. It might be too technical. It might be technical enough for some people. But it's a bit of an overview of what CVI can mean if you have a bit of an understanding of those functions of it. Is CVI then, so as part of this talk you'll have heard it called cortical visual impairment, sometimes it's called cerebral visual impairment, so it does have various different terms and different names, but it all comes under the one umbrella, and children with the condition develop certain characteristics depending on what it's called. It doesn't really matter too much. So basically, in very, very broad terms, anything which disrupts that normal process of vision, which I've gone through very, very briefly, can result in CVI. So anything which disrupts that problem or that process, whether it's damage to the brain or whether it's abnormal development of the brain, so it can cause these visual problems which are linked to CVI.
think we've lost your audio there,
Can
Emma.
you still hear me okay?
Yeah, now we can. Yeah, you're just
yeah,
dropped
I
there
don't
for
know
about
what
5
happened.
seconds. That's all.
That's grand, no problem. Yeah, so just basically due to the complex nature of the process of seeing, children with CBI can present with a multitude of different problems depending on the location of the brain which has been affected. So that's why some children might present with a certain problem, and there might be another child who has a completely different set of problems. Some children might have a normal eye and a normal vision function from that point of view. They might be able to see really well, whereas there's some children with CBI who might have really, really poor vision, as well as other difficulties. So there's a really, really, really broad spectrum of difficulties that a child might experience. And as Sarah mentioned in her talk, it is becoming more and more common, and is considered to be the most common vision problem in childhood in the developed world, and has been for a number of years now. It's highly prevalent among children who have special education. I worked on a project called the Special Education Eye Care Project, which aimed to determine how many unknown problems children in special schools had. And as part of that, we were probing for evidence of CBI. So behind needing glasses to read or to help see far away, visual processing problems was the second most common problem amongst that population. So it does just show you that there are lots of children out there who have some sort of processing difficulties, which maybe aren't recognised or aren't being picked up. So as part of that project, what we did was carry out a full eye examination as well as these visual processing assessments, and then we provided parents and teachers with written reports highlighting the findings of the examination, and within that then, if there were problems that were identified relating to CBI, we provided practical advice then to the parents on how they could make adaptations at home or at school to try and make a difference in alleviating those problems. So difficulties might a child have then? As I said, there's a massive spectrum that this could be, and it just depends on what, where is affected in the brain. And no two children with this condition will be the same. So I think platforms like this are really, really helpful. And hearing from Martina earlier is great, just to hear of some, previous experiences and what works for some parents and things like that. And just sharing experiences is so important in this. Because you really do learn from each other, and like Sarah said, she learns so much from each family, and that's just so true. Because each family learns how to cope with certain things, and sharing that information is so useful. So quite often before a child's diagnosed, or even before you're aware of CBI, a child might demonstrate certain behaviours, and you just don't really understand what they mean or what they're doing, or you think they're just being clumsy, or you can't understand why they're doing things. But provide a diagnosis and just raising your awareness of this condition can help provide you with an explanation, and ultimately can help family relations and how to help the child. So it's a condition which Martina said as well, it can't be cured, but you can improve it and improve your child's quality of life just by implementing simple adaptations within your house. So I'm going to spend just a little bit of time now through the various problems that a child might have. Some of them might sound like your child, others might not. So feel free to take from this what you want and what you might find useful yourself. And hopefully there's something in here which might be useful for you. So let's see, go on to this. So that's just that previous slide I showed. So basically it's just saying that if there's any difficulties in either of these parts of the brain, then it might affect these different functions on the slides there. So I've split the difficulties a child might present with into 6 different categories, and I've taken these mainly from Gordon Dutton's visual skills inventory. So that's the questionnaire which Sarah mentioned as part of her assessment that she does with all children and parents. So it's a 51 item questionnaire, and it just is up of different scenarios which Gordon Dutton has experienced through years and years of working with children and families with CBI. So it might be worth having a look at that if you haven't seen that already. First one I'm going to talk about is crowding and clutter. And this seems to be a major problem that children with CBI experience. Another term for it is visual crowding. And what it basically means is that when your child's in a busy or distracting environment, they find it difficult to see or to cope in their surroundings. So some of this might include that they have difficulty finding an object in a busy room or a messy room that's full of clutter, or they might have difficulty finding an object on a crowded shelf. So if you ask them to go and get you something out of the cupboard, but it's full of cans and lots of different bottles and things, they might have difficulty finding the specific item that you're asking them to find. Likewise, finding a biscuit in a biscuit tin or finding their favourite toy in a toy box. So you can see here, if you ask the child to go and try and find a Tigger in the box full of toys, they might have difficulty doing that. Some others have difficulty seeing something pointing out in the distance. It might not necessarily be that they can't see it because their vision's not good enough, but if you think of an object far away, so I look out my window to the side here, there's a church across the road, but if that was a busy street, I was looking down with lots of children playing, or if there's cars going past, then NCBI I'd be able to see something that my mum was showing me across the road, just because there's too much in the way that's distracting me. Likewise, your child might sit close to the TV, and again, that can be not that they can't see it, but just that by sitting close, they're removing everything else that's distracting them, so it allows them just to focus on that one object in front of them, and removes everything else. I also have difficulty at school if they're asked to read a page which is full of information. So if there's a text on the page, or if there's a lot of pictures, and you're just wondering, can they not see that, or why are they not performing well in what they're being asked to do? There might just be too much there for them to see. I've mentioned crowded room already, and then just finding things in a busy or cluttered room as well. So that you might not have too many things sitting around your room, but even if you have patterned wallpaper or patterned carpets, or it's the child's bedroom, if there's a patterned duvet cover, patterned curtains, things like that, that can be really distracting as well for a child. Then they might not be able to focus on an item that you're asking them to focus on. Finding copying words time consuming and difficult as well. So that might be if the child's at school and they're asked to copy something down from the board. That focus from looking up to the board and then down to a page, that can be really, really exhausting for a child with CVI as well. So I'll talk about things that can be that later on. So like I say, crowding clutter is quite a big one, and there's a lot of simple changes that can be done to try and remove a lot of the issues associated with it. So I'm just going to talk about the problems first of all, and then I'll go through some strategies that you can try to implement to help with this. Okay, so the next one is navigation. So some difficulties which might come under this heading would be that a child struggles to cross over from a carpet onto a wooden floor, or onto laminate, or onto tiles. So there's one example of this I had in the school project we were doing, and the child was coming into our testing room, which was at the school, and she was totally fine walking from her classroom, but as soon as she got to the room we were in, she just took a meltdown and couldn't cross that threshold into our room. So just children sometimes can struggle to appreciate the differences in those floor textures. Another one quite common within this section as well, that a child might struggle to walk over uneven surfaces, or they might bump to things, door frames, low furniture, and obstacles on the floor, and that can maybe be quite frustrating as a parent, because you think, why, how could you not see that? But I think once you have some awareness that, okay, the child has CVI and they're not able to appreciate these differences, then it can help you to understand a bit more what the difficulties that they're facing. Moving objects then, so the child might have difficulty seeing objects which are moving quickly, such as small animals, or if you're trying to show them something that's moving quite quickly, they might struggle to find and locate that. They might avoid watching fast moving TV as well, or choose to watch slow moving programs instead, and have difficulty catching a ball. So again, some of these might ring true with you. They might be true for your child as well, because I know Sarah had mentioned that a lot of children she works with prefer moving objects as well. So like I say, it's such a broad spectrum, and some things might be true for your child and others might not be. Busy places then, so that's another one. So a bit of overlap between this and the crowding and clutter one. But so the first one there, locating, like I mentioned, locating an object whenever there's a busy bedspread or a busy room with busy wallpaper can be difficult for a child as well, because that's a lot of information for them to cope with. A really nice example to explain this is if you can imagine someone's trying to talk to you, but you've got maybe 3 other people trying to talk to you as well, and the TV is going, or there's music going, and it's just a nightmare for you to try and concentrate on the one person that you're trying to focus on, because there's just so much else competing for your attention. So you can imagine that in a visual sense as well. If you're asking the child to look at something in a business environment, there's just so much else that's competing for their visual attention that it's really hard for them to switch off and just focus on the one thing that you're asking them to. A child might get lost easily in crowded places and have difficulty identifying you if you're out in a shop or somewhere where there's a lot going on. So again, I'm going to talk through some ways that you can help this later on. Okay, so then moving on to attention. So that could be if you're asking your child to do more than one visual task at once. So just in the picture example here, you can see there's a mum and she's maybe reading a book with her child. The child's also playing with something in her hands and the TV's on. So if a child is maybe trying to watch TV and do whatever's on the book as well, that might be really, really difficult for them. So Martina mentioned as well that she went to like a quiet space, and just asking the child to focus on one thing at a time can just make a massive difference there. And then you might find that the child has difficulty walking and talking at the same time, or listening to you and looking at you at the same time. So children with CBI have been noted to, whenever you're talking to them, they might look away. So you think that they're not listening, but actually that's helping them to listen, because they're not having to concentrate on seeing you and listening to what you're saying as well. Okay, and then the last one then, so this one relates more to the ventral stream side of things. So a child have difficulty recognizing close relatives, or friends or family in real life, or from photographs, understanding the meaning of facial expression, and naming common colours and basic shapes as well. So that last category, it relates to the ventral stream, as I say, and problems with the ventral stream are less common. So the dorsal ones are much more likely, and the ventral stream as well, they're unlikely to happen on their own. So you might find you have some of these difficulties, but they'll probably go hand in hand with some of the other difficulties I've talked about. Okay, so now that's a brief overview of some of the problems that your child might experience. What can you do about it then? What are some things that you could do to try and help? So there's a lot in this, and your child, you might be thinking, okay, yes, my child has like 10 of those, or maybe more, maybe less. But I think the important thing with these strategies is just to take your time with them and try and implement some at a time. So don't just try and do everything at once, but maybe change a few things, work on that, and then move on to the next thing, rather than trying to overwhelm yourself and your child with just too many changes at once. So just starting with the crowding and clutter, as I said, that's a really big one with CBI. So if they have something, a lot of these, by the way, are just really, there's a lot, they're not groundbreaking strategies. It's just a lot of common sense sometimes and simple things. So they can make a big difference. So yes, if your child's not able to see something in the distance, then moving closer to that object is helpful. Just giving them extra time as well is a massive thing, not just under this section, but for a lot of things, just allowing them that extra time to look, trying to find what you're asking them to see, and just if you're asking them to do a task, just give them extra time to do that. If they have difficulty finding toys or a certain item in their room, using storage boxes for similar toys is a good idea. Limiting the amount that they're playing with at a time is great, and also doing it in a plain, uncluttered surface as well. So just keeping the play area nice and simple, and just having 1 or 2 toys at a time can be really helpful. Another thing is there's certain items as well that your child uses regularly, like say they wear glasses, and if you need them to go and get their glasses, or a pair of shoes, or things that they use regularly, always have a separate home for those items as well is really helpful. I'm going to talk about a case study just at the end of the presentation, and a really nice example of that type of thing within that. If your child sits close to the TV, as I mentioned, that's possibly to minimize any distractions between them and the TV. So removing any clutter that you have between the sofa and where the TV is might be able to help with that. You can also find out what sort of size screen that they prefer, and just removing things like photographs, plants, anything like that you might have sitting on a TV stand can help minimize any clutter there as well. Difficulty reading a crowded page then. So if they're at school and you just find they're struggling to read a page which you maybe would expect them to be able to read, you can limit the amount of text on the page. So there's the technical term is the typoscope. And what that basically is just a little card with a space cut out of it. And you can set that over a page to remove any text the child's not reading at the time, and then just move that down to whatever the child's reading, and that should hopefully help minimize some of the other distractions on the page. Also finding out what sort of font size they like and can see easily, making sure that that's well spaced and is nice and bold as well should help with that. If you're unable to find a specific item on a crowded shelf, again, just removing any clutter that's not needed, minimizing the number of objects that there are, and using plain paper, carpets, duvet spreads, like I mentioned, should have a real impact there. Sorry, my dog's away to investigate something. And then, as I mentioned, having a separate home for each object that a child uses regularly, so that they know exactly where to find it. And once the object has been used, always just putting it back to where it belongs can be really helpful. If they find copying words or drawings difficult from the board or from anything else, what you can do is just ask a teacher to get that printed and have it beside them if need be. I don't know if that's even a thing anymore. Maybe I'm too old. It's the thing of the past copying things from the board. But just having that beside them will be so much less tiring for them to look from there rather than having to change focus up to the board and back down to what they're doing as well. And again, just ask them to do one thing at a time. So whether there's just writing, that's fine. But don't ask them questions at the same time. Just give them enough time to do what they're doing and then move on to the next task. Okay, so this is a little silly exercise to try and explain visual crowding and the difference that it can make. So you have a task here, and what I would like you to do is try and find this little plant in a classroom. Whenever you find it, if you just put in the chat like a wee thumbs up or a wee yes, because then we're going to do it in a busy classroom and then a stripped back classroom just to show the difference. So it'll be interesting to see the time if there's a difference. So yes, the little plant looks like this, and I'm going to click over to the classroom, which I'm sure many of you are familiar with. There are lots of classrooms out there that look like this. So have a look and see if you can find the plant. And if you do, just into the chat when you find it.
Emma, I'm not sure. I'm unable to see that slide. I'm not sure if everyone else is.
No, I can't.
It's still on the crowding clutter slide, Emma.
Oh, okay. Let's see. Maybe there's too much on it. You see the little plant? No?
No.
Yeah. Some people can because they're putting in they can.
How are they? Okay. I'm sorry then for those that can't. I'll just keep it on that slide. That's it up now. Basically, just a really, really busy primary school classroom with lots of coloured tables and lots of nice wall displays and different bits and pieces.
If you just forward back the slide once there, it might update for everyone. Just go back one and then forward one. It might force everyone else's one to move on. It's unusual that most people here are getting it.
Okay. I'm sorry. I don't know how to make it better. Okay. Some people are finding it, so that's great. I'm sorry those that can't find it. Okay. Then I'm going to move on to the next room. So it's a different classroom. This time, for those who can't see it, it's a lot more stripped back. So there's shelves which have covers over them, so it hides all the books and all the clutter and everything that's on them. The wall displays are really minimal, and there's lots of cupboards, which again, lots of clutter and different things are hid behind. So same task again. If you can find a plant on this one, and just type into the when you find it. Hopefully, it's easier to find this time. So a classroom example, but the same sort of principle applies at home as well. So just if you are fond of having maybe lots of pictures on your walls or patterned wallpapers and things, stripping those back can really minimize any distractions that your child might have. There's a study conducted in New Zealand as well, which just showed concentration levels whenever a child was just sort of isolated in a corner on their own, where they had no distractions. And were able to just focus on their work, and they found that the child was able to cope much better in that situation as well, whenever all those distractions are removed. So I'll move on to the next one. Okay, can you see now there's pictures?
Oh, it's still
on
the crowding clutter
you're actually
one.
two little videos.
Emma, I wonder
Just
if
to say,
you just stop sharing for a second and reshared.
I left Daniel and Kate back in.
Yeah, let's see.
Yeah, I did the same, Daniel, and it's up on the screen for me now as well. So
just to say, if anyone it's frozen, maybe if they leave and we'll let them back in.
Back in, yeah.
Well, it's if you want to, but it's maybe not that exciting to do that. It's maybe not worth it. Let's see. I'll try and go back out here. Let's see. Okay.
There you are now. Yeah.
Can you see my screen now?
Now you're back.
Okay.
Yeah. Perfect.
Great. So I'll just quickly. Can you see the classroom picture now?
Yeah.
Yeah.
Open up now.
So that's just to show you, for those who couldn't see it before, just a really, really busy classroom, which a lot of us will be familiar with, and then a stripped back one, which can just have a big impact on the child's ability to see and process what they're being asked to do. Okay, so these next ones are just two short videos, again, just showing a task. This is little boy Luke, and he's been asked to try and circle, I don't know, it is odd numbers or something, and the first one, you can see his reaction whenever it's really busy. Just not having a time there because there's a lot of distractions. There's a patterned wall or a patterned tablecloth, lots of different bits and pieces around his worksheet, and the grid itself is really busy and looks just really struggling. He's having a bad time. If you take all of that away, have a nice clean table, make the text bigger, more spaced out, you can see his reaction. He's happier in that task. So we can just see the difference that something simple like that can make. Okay, and then just some more classroom considerations as well. So again, the picture in the bottom left shows an example of a busy desk. There's lots of different things sitting there that maybe aren't needed at the particular time. If you just remove all of that and just have one thing that the child needs, then that'll hopefully be much easier for them to see. And just another one then about print size. So the picture on the left is just a standard textbook, which could be quite difficult to read. So in that example, you could put a piece of paper over this lower half if you're just asking them to read the top part, and just remove any text that's not required, or have it well spaced. A font size, Comic Sans is a good font because it's well spaced, and just making that bigger and bolder as well should be easier for them to see. Okay, so then on to navigation. In the interest, I'm not going to go through all of these because there's quite a lot, but the slides can be available afterwards as well, or you can take pictures of these if you want to. So some things that you can do, so if a child has difficulty walking over uneven surfaces, if they have a pram, like a push pram or a scooter, holding that in front of them can really help them to distinguish changes in the floor surface, or hold onto your arm whenever you're walking. Wearing white trainers as well help improve the contrast between the child's feet and the floor, which can help them to see better what they're walking over. If they have difficulty seeing differences between tiles and a carpet, putting coloured tape along those floor surfaces, and also, if I move on to the next one, if they bump into door frames or furniture, putting coloured tape around door frames or at the edges of stairs to help improve the contrast can really help as well. And just help those stand out a bit more. So again, it's like Martina was saying, that she put red on everything, and find out what colour your child can see visibly, and hopefully that will help them to highlight different changes in objects and surface level. Okay, so moving objects then, some things you can do is just making people aware of the difficulties. It's great because then they know what difficulties your child might have. So ask them to introduce themselves whenever they come up to the child, if there's a lot going on around them. You can teach the child to track their head rather than just moving their eye, and to try and train them to pick out important objects or important people. If you find they're pouring a drink and they tend to overspill, that's quite a fast moving liquid, so they might have difficulty with that. So using clear plastic cups might help them see the liquid coming in a bit easier. If they avoid watching fast-moving TV programs where the presenter sits or stands still or reads the story, they might be more suitable, more comfortable for your child to watch as well. Okay, busy places then, again, similar to the clutter one, just think minimal, reduce everything. If there's not something that's not needed to be out, put it away, hide it behind something. If the child gets lost in crowded places or difficulty finding you, try and visit those places whenever it's quieter, or so if you're going to the supermarket, you want to take your child with you, go maybe in the evening if it's a bit quieter, and also if you're going somewhere new with your child, it might be good to go there before an event. So say you were going somewhere for a birthday party where it's going to be very busy, it might be good to go there beforehand and just get familiar, find out where the toilets are, have a pre-arranged meeting place to find your child if they're struggling and they need to just have a little bit of a time out, and just get them familiar before the event actually starts, and really help. Okay, so if they have difficulty finding items of clothing or items that they use regularly, you can use little drawer tidies to separate similar items as well, and that might help with that. I think I've covered some of those already, so I'm not going to go through each one of these just in the interest of time. Okay, and then attention, like I've mentioned as well. So if you're asking a child to do something, just ask them to do one thing at once rather than expecting too much of them, and even ask to listen to you while they're doing the task as well. As I said, you better just doing one thing at a time with that, and reducing any distractions that might be around them. And if they bump into things whenever they're walking and talking, again, just try not to speak to the child unless you need to during a walk, and just let them focus on what they're doing. Okay, and then the last one then, recognition. So dog's getting off again. So wearing easily identifiable clothing can be really helpful. So again, like Martina said, she wore red lipstick because that helped her child identify her. So things like that, and just make sure your child's aware of what you're wearing. If your child doesn't understand the meaning of facial expressions, you can give a verbal explanation to accompany the facial expression that you're just to help to teach and to learn that. And also encourage the child to listen to the tone of voice people are using as well, because that can help understand emotions. Okay, so just to go through this little case study then. So this is Jane, who we saw at the special school that we were working in. So just a bit of background, she's a 15-year-old female. She has a rare chromosome disorder and 3 cysts on her brain which were noted at birth. Severe learning difficulties, orthopedic problems, autistic traits, and various other things going on. In terms of her eye examinations or ocular history, her mum reported a history of blurred vision. She was very light sensitive. Her mum said she finds it difficult to see the board at school. She wears glasses. She's long-sighted with astigmatism, and she's diagnosed with Sjogren syndrome, which is just a dryness at the front of her eyes. So whenever we saw her, we measured her vision, and it was reduced for her age at both distance and near. We tested this using a row of letters, so in a crowded format. Whenever we tested this with just one letter at a time, this improved. She also had reduced contrast. So contrast is our ability to see like grey things on a grey background. So whenever there's the contrast between things isn't very good. So that was reduced for her age. Her eyes looked healthy, and we didn't find any change in her glasses prescription. But her mum noted a lot of difficulties on the CBI questionnaire. We then saw her 3 months later, and her vision had significantly improved both at distance and near, despite us not intervening with her glasses prescription, and her contrast improved. So the reason I'm including that information is just to show that day-to-day vision can fluctuate and can change. So a child with CBI might perform really terribly one day, they might be tired, they might be exhausted, and their vision's just really poor. Next day, if they're well rested and there's no other distractions or anything, they might perform much better. So it can vary day to day. Okay, so then these are just some of the key difficulties which were highlighted by the mum. So she noted that Jane had difficulty. She always tripped over objects on the floor, had difficulty walking down stairs and pavements. She'd always look down to cross the floor boundaries, and she found really uneven ground difficult to walk over and would lose her balance quite a lot and fall over. She bumps into things when walking and having a conversation. Rooms, a lot of clutter would cause difficult behaviour, and same with a busy supermarket as well. She had difficulty seeing things which are pointed out in the distance, finding something in a crowded box, and found copying words time-consuming and difficulty. And interestingly, she noted that her performance on school test was also reduced. So her recent statement assessment, Jane was asked to perform a task. The page is very hard and she couldn't process it, and she performed very badly on the test, and her mum just couldn't understand why, because she knew it was something that previously she was able to do. She retook the test then and had the print was improved. It was much larger. The sentences were isolated, so they covered the rest of the page, which wasn't needed. And then she performed really well on that test. So it just shows you by minimising things which aren't needed at the time can make a massive difference in performance. Jane's mum would also ask the child to go and get something from her room, but she was unable to find it, and she couldn't understand why, because she knew that she could see. But there was just too much clutter in the room for her to find the object that she needed. And she always noted that she would have fallen over grass and would have broken her arm and things, and just she was really clumsy. But since having the CBI diagnosis, she didn't understand that that's why. It's not that she's clumsy, it's just that she has difficulties with those changes in surface. Also noted as well that whenever she went to get her eyes tested on the high street, she really struggled whenever the letters were printed in a crowded format, but if they were presented on their own, then she performed much better. Okay, so then some of the advice then that we provided to Jane's mum and things that she's implemented then. So she says that her child, even though she could be 18 or 19 now, she would use a little push pram whenever she's out walking, and that really helps her to find the changes in gradients of hills and slopes. She's hopefully going to get some training using walking posting, and they use high visibility tape on stairs and around door frames and on floor surfaces, which really helps her to stop bumping into those and to walk down and upstairs a lot easier. They've reduced all of the core at home, kept it really minimal, and they attend shops during quieter off-peak times. And then, as I mentioned, in school they cover text that's not being read, use isolated sentences and larger print. And they now have a separate home for Jane's shoes, her glasses, any objects that she's using regularly, so she knows exactly where to go at home to find those, and it's made a massive difference. But one thing what Jane's mum said that really struck with me is that receiving that diagnosis of CBI has helped to give an explanation for her behaviours, and that's just changed their family life massively, because they now understand her more and they understand how they can learn to help her. So just more raising awareness of this condition can just make a massive difference to your family. So I think I've gone over time, but I was going to spend just a couple of minutes going through. So Ulster University have developed this website called Ulster Vision Resources. So I'm just going to show you quickly some things on that might be helpful if you want to go and read up some more about this. I have time for that, or do you want me to stop?
I think we're okay, Emma, for another couple of minutes, just because we started a little bit earlier. So if you want to just go through that for maybe another 1 or 2 minutes, and then we'll have a couple of questions. Is that okay?
That's fine, no problem.
Thanks, Emma.
Okay, so I will try. Okay, can you see a Google Chrome page now, or is it still my presentation?
I see in
the
you're
on a website there.
The website, yeah.
Okay. So, this is called Ulster Vision Resources. So if you Google that, hopefully it should come up, and it brings you to this homepage here. So if I just click into resources for parents, there's lots of information in here and explains like common terms that you might hear in an eye examination, and just gives advice on different things that you can do if your child has reduced vision, as well as CBI. So these resources here are really useful and good for sharing with school. So you can find out what level of vision your child has from their eye care professional, and then choose whichever one of these most closely relates to them. So if your child has 660 vision, click on this and this brings up a PDF then with some really useful information about what text size your child should be able to see clearly. So it talks here about size 26 font. If they use text, what size should be visible, and things like that. So they're quite useful and quite nice to share with the teacher, particularly if they don't have much information on this. So I'm going to go back. If you go into resources for professionals, don't be put off by the fact that it says professionals. You're the professionals of your child. If you then go into cerebral visual impairment assessment and then go down here, it mentions visual skills inventory. So that's the questionnaire that Gordon Dutton developed, which I mentioned, and what a lot of those strategies are taken from. So there's copies of the questionnaires here. And then down below is probably the most helpful thing for yourselves. There's just some strategies here. So those are some where I've taken my information from today. So if there's some there that don't relate to you or that do relate to you, have a look in there and you can get some more information on things to try out that might be helpful for you. I think that's maybe the main thing. Oh, this is quite helpful as well. If your child have reduced vision, again, that's those worksheets which are quite good for sharing with teachers. And further down as well, again, if you find out what level of vision your child has from their eye care professional, if you click either of these PDFs, it'll show you the size of pictures and images that your child should be able to see and certain distances. So that might be helpful for you. And then if I just go back to my presentation, there's some websites there as well which are really useful with more information. CVI Scotland's brilliant. They are really good at just explaining lots of different things to do with CVI, so it's worth checking out. And Professor John Ravenscroft is he's a lecturer over in Edinburgh, and he started a series of conversations about CVI. So he talks to various different professionals from around the world, and there's some really useful information within those as well, and a really, really broad mixture of people too. So they're worth checking out as well. Okay, I'll stop there because I'm sorry I've gone way over time.
No, that was brilliant.
And yes, if anyone has any questions after today, you can email me anytime, that's no problem.
Brilliant, Emma. Thanks so much. That was really, really informative and so many strategies there that I'm sure everybody's going to take something from that. I'm just going to go through the chat. I think there was a couple of questions. So a lot of thank yous coming in, Emma, very helpful. It was great. Is there a question here? Sorry, no, I'll just bring that. Yeah, there was one question. So if we have a diagnosis of lower stream dysfunction given by Gordon Dutton many years ago, where can we get assistance in Ireland for this? I don't know, Emma, can you answer that for Ireland, but up north, or can you share anything on that question?
So lower stream dysfunction.
A diagnosis of lower stream dysfunction. So given by Gordon Dutton many years ago. Yeah.
Okay, that's maybe a more term. It's kind of broadly meaning CVI. So where can you get more support for that?
Well, they were saying specifically Ireland. I don't know, like up north, Emma, is there someone that like in the north? What is like? Do people get support with that directly? Like the strategies that you've shared with us. Is there someone that would support that? I know we can talk about in Ireland. Like if people haven't had support, like NCBI can support with that, and we'll be chatting about that as well. With our last speaker, Aileen, she'll be going through the supports that NCBI can provide. But I suppose, like up the north, Emma, can you answer that even in, because I know I wouldn't expect you to know in Ireland where you are.
Yeah, so the guide dogs have recently combined. There's a couple of different charities that have come together, so they're really good, and they have a separate CVI kind of support service, so they're definitely worth getting in touch with. So it's guide dogs in Northern Ireland, because I think Child Vision, and I can't remember what charities joined together, Children UK and something else maybe came together. So they're good people to get in touch with, and I know they offer practical training and things like that as well. But they tend to need like a diagnosis, so if she's had one, then that should hopefully be okay.
Brilliant. Perfect. Thanks, Emma. And like that, what I was saying, in Ireland, like NCBI can provide similar interventions like that you've mentioned, Emma, those strategies. So to link in with ourselves again, and that we can have a review. But again, we'll be chatting about that later on, about the support we can offer. So another question here, Emma, from Karina. Can you get more specific diagnosis versus general CVI diagnosis from a brain injury? And if so, how and where?
So Karina, has your child got a general CVI diagnosis already? So
She
to get
does,
a CVI diagnosis, it does. Okay. And so you would like a more specific one?
Well, I got it 12 years ago, so things were very different then. And I've tried almost, it's funny, I tried almost everything you had on the list. I've tried them all. I've had, how did I teach her to read? Eventually, she was crowded on the words. We put the top 100 words in packs of 10 all over the room in big font, and we just got her to sight recognize them. And so eventually, when she looked at a page, she at least found something she recognized on it, and then the rest filled in.
Oh.
You know, so I tried nearly everything you've got there. They work.
Yeah.
I tried them, but I was very interested in the brain picture and the pattern and all of that, and the upper and lower. I'd never heard that before now, and I would wonder if there was anything in it, and if so, how could we even? She's occipital lobe damage. It's gone. Her occipital lobe is gone. But it was 11 years ago, 12 years ago, back in 2009. So things were very different then than they are now. An understanding of brain injury.
Yeah. And is she still seen by a specialist or by an ophthalmologist or anybody like that?
She is, and we've engaged with the NCBI, and they've been very supportive with the school and the education in the eye and ear. But it's more around her sight.
Oh, sorry.
It's more around her sight than her CVI. We haven't really gone after this in a while, and I'm thinking perhaps we should.
Yeah. And has she been registered with a sight impairment or anything?
Yes. Yeah, she sorry. Well, the other bit is with her sight has continued to improve, ironically. So she is seeing somewhere else in the brain, and they don't know how, but it is continuing to, her sight is continuing to improve all the time. So I wouldn't mind having a look now to see, as she heads to more adult life, how to set her up to take care of this herself.
Yeah, no, absolutely.
Yeah. She couldn't.
No, well, I know definitely up here. Sorry, go ahead.
Yeah, I was just saying, like when she came out of coma, she couldn't see a thing. But we were told that it was some optic nerve damage because of traumatic brain injury, and oxygen deprivation everywhere in her body, septicemic toxic shock syndrome. So all that, but so it was oxygen deprivation, but she couldn't see. But then she got sight back, and then it's continued to improve. So now she's 20/20 in one eye, but no central vision in the other eye. But it's the occipital lobe is never coming back. But she functions very, very well. But she does have all the things you were saying there. But again, this has got me thinking about going after that, be it upper or lower, or just actually understanding the brain function conversation a bit better. So I don't even know where to start on that one. I've been doing all the interventions. I haven't gone after the medicine.
No, that's good. If you speak to your ophthalmologist, and then if they can sort of pinpoint where the problems are, or if she's ever had an MRI before, you might be able to link where in the brain the difficulties are, and then map that to which part is affected, and then whether that's dorsal or ventral. To be honest, it probably doesn't matter too much. The fact she's got a diagnosis is great, and at least you are implementing the problems or the strategies and things yourself to try and help her. So it sounds like you're doing great and doing all the right things.
And we can follow up, Karina, as well, and give you some resources on if you want to get more information on that. Like that, we can follow up you after as well. So I'm just thinking of time, guys. So there's just I'll ask another question, Emma, if that's okay. And would it be okay for you, Emma, if other people have had other questions that we might get them to email us in and we'll come back to you with the answers? Would that be okay, Emma, with you if we did that?
Yes.
Okay. Will I start away? I wonder, am I good to go?
I think everybody is back in, yeah.
I think we're all here, are we?
Yeah, Jean is back anyway, so that means her room is successfully closed. And we might have just dropped one or two, depending on the devices were, but I'll keep an eye on the lobby and admit those that have been accidentally knocked off.
Okay. Okay. I'll start away. Okay, thanks, folks. I'm Aileen Ahern.
Sorry, interrupting there, Aileen. No, I was just going to say to introduce you and say no, that's okay. So we have Aileen here, Aileen Ahern. I'm sure a lot of you guys know her. So she's a member of the NCBI Children and Young Persons team. So Aileen is just going to have a discussion now around NCBI service pathway for children with NVI or CVI and talk about some supports that are available within NCBI. So I'll hand you over to Aileen.
Great. Thanks, Lisa.
No problem.
I'm going to start sharing my screen, if that's okay. Hopefully that's working. Is that good?
Yeah, it is, Aileen.
Okay, perfect.
Yeah,
okay, so folks, just I suppose to introduce myself, I'm Aileen, like Lisa said, and I'm on the children's team. I know from the audience that I suppose we have a number of parents maybe who are new to the service or newish, you know, in the last couple of years. And then I know we have some parents who have been around a while and probably have received services or know of NCBI for a number of years. But just I suppose what we wanted to do today was just maybe give a little bit of information. We know we haven't been doing well, possibly with working with CVI over the years as well. You know, no more than what Sarah was talking about, that we're striving all the time to be doing better in relation to CVI. So be that in relation to training our own staff and understanding the situation better, maybe communicating that better to parents, and then using that information to give it to the other people working with children. So I suppose today is part of that process. Over the last 2 years, we have created, or we've developed our Children and Young Persons team, which is a dedicated team for working with children. We didn't have that previously, as some of you may know. So I suppose what we're looking at today is how we improve going forward. I suppose really is what we kind of just wanted to sum it up at the end of today's conference. So just so that people know, we now have 11 dedicated caseworkers working all over the country on the children's team. We have a programs coordinator and we have an early years specialist, Karen, who is on this conference as well. We also have assistive technology trainers and we have clerical support team lead. But what we also have is our iClinic liaison officer, who Sarah mentioned earlier on, Hilary. So I suppose what we're trying to do is build our better relationships with the iClinics, with Temple Street and Crumlin, so that if there's earlier diagnosis, there's early referral into our services, and then hopefully we're putting supports in place earlier, and we're much better informed with much better relationships with the medical team. So hopefully we're hoping to improve in our service all the time. So in relation to multiple disability, and in relation to cortical vision impairment, I suppose we offer an assessment and an intervention process where we meet with your child and try to do an assessment, like I suppose what Sarah and Emma have been talking about there, about trying to recommend what interventions will help with your child. We're doing some staff training, and I suppose this is part of it as well, as I say today, improving all the staff that are working with kids, that they would have a much better awareness of what CVI is and what that means and the interventions that can be recommended. But we're also trying to better inform the intervention teams that are already working with your children. So maybe the early intervention team, the school age team, or other professionals, the school supports, that we can better inform them about your child's individual needs. Okay, so just I suppose to give you some numbers just quickly, the breakdown of children registered with NCBI. So we have 61% would be listed as sight loss as their primary disability. Then we have 39% who would be listed with multiple disability vision impairments. So vision may not be their primary disability. You know, they may have a physical disability or an intellectual disability, or, you know, some combination of additional needs. So I suppose that we feel, I suppose, impacts on how we can deliver a service as well, or where we fit within the role of service provision. So Leah, Dr. Leah Heiner, and then I'm sorry, now I'm not probably pronouncing her name correctly. I suppose she is a consultant ophthalmologist, and she is always saying that, I suppose, for kids with a, you know, where vision isn't their primary disability, often it can be missed, or it can be maybe minimised, or maybe we're not supporting it in the way that we should. And it also, I suppose, that you know, the other disability or the other needs might be, you know, seen to, they might be diagnosed earlier, and oftentimes the vision maybe might be interpreted as a behavioural problem or an intellectual disability. And I think in relation to CVI, there in some of the strategies, I suppose, you know, sometimes it can be misunderstood, or you know, I suppose not, that the strategies aren't put in place, and when they are put in place, you can see big improvements in a child's behaviour or in their ability. So just wanted to put up that quote. So okay, so I suppose, as I say, when vision impairment is the primary disability, or even if there's a secondary disability but vision is the primary need, we would work with children in a certain way, where we would be looking at their visual acuity and making recommendations based on that. With children with CVI and maybe with other complex needs, we're trying to work in a slightly different way. So this is just the model of when vision is their primary disability, and you can see there the child is in the centre. We would be close enough to the child in that we would be supporting their education staff, possibly working closely with the VTs, working closely with other professionals who are working with the child. The medical team may not be as involved, because your child's vision may be stable and they might be just having annual reviews, or, you know, they may not have high medical needs, and your child mightn't be involved at all with the early intervention team or with the community supports. When a child has CVI or maybe a multiple disability, and the vision may be seen as being secondary, the child might have regular involvement with the early intervention team or with the medical team. There might be high medical needs, and I suppose they might often be the closest people. You might have an OT, physio, you know, a team of people working with your child. Education will be next then, you know, and then we would see ourselves being slightly outside of that, but supporting those people involved, I suppose, is how we would look at it, and trying to inform people, and trying to, you know, get information, give it to parents, you know, or help parents to understand the child's vision, but use that information then to give to the relevant personnel who are working with the child on a daily or a bit more often basis. Okay, so our pathway, what we're trying to do is deliver, I suppose, standardise our service across the country and across, you know, for all children who are coming into our service now. So referrals for children can be made by parents, by the, you know, the eye clinic team, any healthcare professional or educational professionals. Any child that is having difficulty can be referred in. And I suppose just to say on that, because I suppose we have our eye clinic liaison officer now, and because of maybe that children are being referred to us earlier and possibly referred to us, you know, at maybe diagnosis stage, a number of referrals can be made, and we are very aware of that maybe parents can be, you know, sometimes overwhelmed by the amount of professionals that are coming in, asking questions, you know, starting off working with your child and coming maybe all individually, and I suppose we're very conscious of that, and I suppose we want to just try to see how better we can support a family without overwhelming them, or, you know, so I suppose what we're looking at is how we can support the other professionals who are working with your child, to maybe have better outcomes for your child, I suppose, most importantly, and for the family as well, and all that they have to deal with. So okay, that initial screening is what we will do. So when we make contact with you initially, and that's really to discuss the referral with you, to find out, you know, the reason for referral, get some more history from you, get, you know, the medical maybe information, get some developmental history back, or information about, you know, what has happened or where your child is at. we might gather information about the child's additional needs and the impact that that's having on their daily activities. Again, some Emma, I think, mentioned the questionnaires there that the Ulster University have devised. We have a similar.
Aileen, sorry to interrupt your flow there, but just we're still stuck on the slide there, 60 to 80%. So if you want to stop sharing, maybe and come back share again. It seems to be an issue with some PowerPoints this morning.
Okay, so 1 second now. Sorry. Give me a minute. So. No. Okay, so is that a bit better? Have I caught up?
That's moved on there, Aileen. And we're looking at the referral pathways. Yeah, that's it. And
Okay.
we can send the slides to parents afterwards.
Okay.
Yeah, if anybody wants them, that's no problem at all.
Okay, perfect. Okay, so I think I have. I mean, the previous it was just a diagram, and I think I was I've explained it. But like you say, Lacey, we can always forward it on. Okay, so I suppose so we do use a questionnaire as well, and we've devised that from Gordon Dutton and from the Ulster University to get that information about your child's vision, and we think it's a way also of helping parents maybe understand what the characteristics might be, what to be watching out for. And then, as I say, so, it's not an assessment that we are doing. It's really, I suppose, helping you as parents to maybe see the characteristics and to know what to watch out for, and then maybe to devise that we would help devise some interventions with you about what might help. Okay, and then also at that stage we would get consent or permission to contact other service providers. Okay, so the next stage, I suppose, then, if parents are happy, to move on to the next stage, if there's not a lot of other people involved, maybe it might be appropriate to move on to the next assessment, which will generally take place in a familiar environment to your child. So, that mostly will be at home. It might be in school, I suppose, depending on the age of your child, or it might be with the early intervention team. We might do a joint assessment with physio or OT, depending on who your child is possibly familiar with. And again, all the time we're trying to gather more information from you as parents, and giving back information about NVI, CVI, trying to make sense of things. As I think Emma and Sarah both said today, I suppose the fact that the vision fluctuates, or the fact that things may not always happen. Today your child might see certain things, or you might react to certain things. Tomorrow it might be different, I suppose. So it's trying to understand that complexity and trying to understand those characteristics, and but try to break it down to see what can we pull from that, what kind of information can we pull from that, and how to build on that. So we would do some brief observations of the child and how they're doing their daily activities and in their environment, and basically, so making some suggestions again at that stage of interventions that might be helpful. Again, it's going back to kind of the strategies that Emma has there. When we can break down and maybe identify the difficulties, we can try and maybe put in some interventions that might help. Okay, so then moving on, I suppose, and like that, I suppose the assessment process happens over a number of sessions, really, I suppose, or a number of it's not a one session assessment. It'll be ongoing, really. I suppose that we would link up maybe possibly with the school again afterwards to get some further information, and maybe again with the early intervention team to get more information. And then I suppose the objectives of it are like that we will have more focus on the visual skills, paying attention to the characteristics associated with CVI, making recommendations about what in the environment, what adaptations might be needed, looking at the daily living activities, and maybe seeing if we can color, if we can suggest some color contrast, if we can suggest some simplifying things down, breaking things down into smaller steps, bringing things closer, decluttering. Again, in every activity, how we can put those strategies in place, and then again making further intervention recommendations and giving some resources. And then, so part 4, I suppose, is where we might bring a child into an unfamiliar environment. That might not always happen. It might not always be appropriate, maybe at the beginning, to do that, or it mightn't give us any much more information than we've already got. Like Sarah says, it can be difficult sometimes for children to be, it can be unsettling, or it can be very distressing for them to come to an unfamiliar environment. So, it may not be necessary. We can get information from you as a parent about, where their difficulties are, and maybe discuss that with you, as opposed to bringing the child into an unfamiliar environment. But I suppose what we can try to, that information that you would tell us will inform maybe some of the recommendations that we can make to see how to help your child to learn, and to deal with the world, like Martina said earlier on. So again, you're looking at further, giving more information about how we can adapt the environment, and then a trial of intervention solutions. And I think Martina mentioned it possibly, or it was maybe in my breakout room, repetition. And I think trying stuff and repeating it and allowing that time to maybe see if something is working or not. A lot of these strategies may be a slow process, and you may not see reaction straight away. But I think even if that, hopefully parents got that from today, that it's like, it's particularly Martina and what she said about, looking back over 8 years, that things have worked, and that changes, that improvements have been made. Okay, so I suppose where we're going from here, so oftentimes we will produce a report, and I think what Emma has mentioned there around, having specifics around what is really helpful for my child, having a handout or having something to say, okay, this is what CVI means and this is what's helpful. That, I think we need to get better at that, at giving that specific information, helping parents to draw that information together, and then giving it to the people who are working closely with your child. And I think, again, it was mentioned by a parent in my breakout room, because maybe staff change, or an SNA changes, or because teachers might change, to remembering to constantly give that information back again all the time to new people coming in, so that they do understand what helps your child, what your child likes and what they need to see. So I think, working with parents to help them to create that report, and whether it's a formal report with loads of fancy language, or whether it's a handout around what specifics your child needs, I think that's something that we need to really improve and work on with parents. Then I suppose, as such, oftentimes at a certain point, you may feel that we don't have any contact with you, or NCBI isn't contacting, and I suppose we feel then that because there may be lots of other people involved, that we would pull back then at that stage. If we have created those interventions or recommendations with you, we've put them together, we've kind of given them to you and maybe the other professionals involved, that we may not be as active with yourselves, but we would always ask that you would contact us if there's something that you feel that we can help with, or maybe at certain stages of your child's life, so that if your child is moving to a new school, transitioning into a new service, and maybe then again it would be important to review to see what supports need to be put in place at that stage, if there has been an improvement or deterioration in vision, and if new interventions are required, that we would do that. And I would also encourage you maybe to stay on our mailing list, that just if there's things coming on, resources being sent out, information sessions, that you would get them, and that you would just kind of keep in touch. So, okay, and I suppose just to mention one other thing that we have developed in the last while, is our Learning Through Play groups that are open to children between 0 and 5. So it's really kind of a preschool group, where children, our parents are coming together virtually, I suppose, at the moment from all over the country. But again, it's to kind of give that practical and emotional support that parents and family might need at that early stages, parents meeting other parents, and making some recommendations about your child. So we have a specific group in relation to CVI, or in relation to maybe kids with multiple disability. So we would kind of group you according to the needs of your child, and maybe be with similar parents. So I suppose that's it. It's really, as I say, just to give an update about where we are in all this. Today is really part of our process of striving to do better, of informing all our staff, but also informing parents about what we can support. And I would, I suppose, say to you that if you haven't had contact with NCBI for a number of years, that it might be worth linking back up again to just sit down and maybe go through, you know, where your child is at. I suppose do a review, CVI assessment to see, you know, what characteristics are evident in your child, and then maybe come, you know, discuss some strategies and some recommendations that might be helpful. Okay, so if anyone has any questions, we can take them. I'm going to stop sharing if I can. So sorry, yeah, I wasn't able to see the chat there when I'm sharing. Okay, so I can just see just the last one coming in there. How can we join the Learning Through Play groups? Sorry, I should put up the contact details at the end. You know, you can contact your local worker if you know who that person is directly, or you can contact us through our helpline. 1850 33 43 53 is just our information line directly, and then you can, you know, you can discuss it with the local worker or be referred directly into the Learning Through Play groups. I think they're running monthly at the moment, well, depending, I suppose, as I say, on the need or on the group, but that it's something that you can link back in. Okay, so I'm just going back over maybe some of the questions.
They're ailing is, can we run courses for SNAs on CVI? Another one said that it's vital for SNAs to understand CVI. And I think absolutely. I think, you know, the sharing of information is what seems to be really coming out today, that, you know, I suppose you might understand your child's vision, or, you know, but try to get that message across to all staff. So I think that's a really good idea to maybe be, you know, give that information, you know, and do something kind of general like we have done today, but also trying to do something specific for your child, that maybe that we would look again, review it and see what is helpful for your child, and give those specifics of what, you know, what you have found about your child, or, you know, has worked for them, and give that direct information to their SNA. And again, you know, if staff are changing, to make sure that that information is updated. I think Siobhan Quigley has a question. Leave your hand up, Siobhan, if you want to come in and ask a question.
Question is, my son is almost 9, so we've had a diagnosis for quite a few years at this stage, but I'm just wondering, in terms of the bigger picture and education, there's a lot of movement now to have children like my son in special classes within mainstream schools, and he's currently in a class, there's only 3 in our county. I live in Mayo. It's described as a class for multiple disabilities, and I was recently looking into it, and nationally there are about 1,200 of these special classes for children with autism. So, like, there's multiple classes in every county. And similarly, children that are, you know, hearing impaired or deaf, there's about 67 of these special classes specifically for children with hearing impairment. Yet, around the country, there's none for children with CVI or visual impairment. And really, Child Vision and their school there is kind of the national centre. But obviously, if you live in Mayo, that, you know, it's completely out of our reach. And I'm just wondering, in terms of advocacy and that kind of strategic thinking, is there anything we can do, or that you can do as an organisation, or that we can do together as parents and NCBI to advocate with the Department of Education for classes for these children with CVI to be established? Because what we're trying to do is, I suppose, mould our kids into a system that doesn't, a lot of the times, I mean, there's a lot of talk today about training for SNAs and training for teachers and increasing awareness, but I just feel that that's nearly sometimes maybe the long way round to approaching it, and we should be advocating more for these special classes to have that focus, for, even if we started with looking for 1 per county, that these children could be grouped together, and that it would be someone that would understand CVI, and that the classroom would be set up, you know, decluttered, and all the other things that we're talking about today. I mean, is that wishful thinking on my part, or is that something that is achievable?
Is it Siobhan? Sorry, I missed your, when you put your name up. Is it Siobhan? Yeah.
Siobhan, yeah.
Siobhan, sorry, I just want to check your name. I suppose, Siobhan, I don't know if it's wishful thinking on your part. I suppose, again, it's down to numbers, I suppose, and maybe the numbers of kids in certain areas. But I definitely think, you know, that what you're suggesting could be a really good idea, that you're sharing those resources, sharing that information, and bringing people together, bringing kids together who are similar. I suppose no more than what Martina said there, that with Child Vision, that when they understand what her son's vision needs were, you know, the difference that makes to him. It's certainly something that we can, I suppose after today, it's certainly something that we can, you know, look at and discuss. We do have links with the NCSE, you know, very close links. We're trying to work very closely with them and build up our relationships with them to feed back that information. You know, and it's something that maybe we could look at, working with the CNOs across the country, just to see, I suppose, you know, is there something that we can do? Can we do this better? And I suppose that's what today is really about, is to get that information from parents and just see, you know, what can be done. So I suppose I don't know. I suppose to answer your question, you know, I don't think it's wishful thinking on your part. I think it's something that could be a really good suggestion. But it's about working, I suppose, advocating on your behalves, directly with CNOs and directly with the NCSE, around that. Would any other parent maybe, I suppose, reiterate what Siobhan is saying? Siobhan makes complete sense. Yeah, okay, agree with Siobhan. We'll be happy to pay. Okay, and I think, you know, from this, it might be something that, you know, we might have a support group. I think that was one of the questions in the breakout rooms, that we might bring a group of parents together and just try to see, you know, can we share that information and maybe see where we go going forward. Shona, have you a question? I think your hand is up.
Yeah, I just want to completely agree with what Siobhan is saying there. I know, you know, vision impairment services across the board, you know, it's hard accessing sometimes. NCBI, don't get me wrong, has been fantastic, and for me personally a lifesaver. But at the same time, accessing stuff for our children in Mayo is a huge deficit there. So I would totally agree, and I know it is wishful thinking to a certain extent, but I would wish the same as Siobhan. It's very hard to see your children not get services just because the area they've grown up in. Yes. You know, simple things like when we go to city centres, you know, they already have to cope with extra transport, extra population, all these adaptations that they wouldn't have to necessarily have if they were reared in a city. But on top of that, then we have absolutely zero services down here. So yeah, I just want to say, yeah, I totally agree with Siobhan, really.
Okay, thanks, Shona. I think, you know, I suppose, and I can kind of conscious of the time again, but I don't want to cut you off, because I think what you're raising is really valid. But I think what you're suggesting there, maybe about discussing it even further, you know, in some sort of a smaller group or an advocacy group. And do you want to come back in, Siobhan?
Yeah, I was just saying, I think like a practical thing that could come out of today would be even just a simple online survey, to just, you know, have those numbers for NCSE to say, look, you know, we as an organisation have X amount of children under our care, these are the numbers, and, you know, this is what the parents want and what they need. And I think as well, from NCSE point of view, it would actually be an efficient use of their resources if they were to pool these children together, and the SNAs that are trained and the teachers that are trained, into 1 or 2 classes per county, to even pilot it and see, you know, how effective it is. Because again, and at some point today, I heard a figure of 1 in 30 children having CVI. So, you know, I mean, it might be a handful of children that are diagnosed, say, for example, in Mayo, but they're out there. And I would actually wonder, and I know work done in the UK around children with autism, and in actual fact, they had CVI, because a lot of the characteristics of CVI can be, I suppose, mistaken for autism, and there's so much awareness now around autism that, you know, if you're not thinking CVI, it's very easy to get a diagnosis of autism where it's actually CVI that's the issue. So, and that's been our experience, you know, with my child. You know, he does not have autism, but it took us a few years to pick it apart. And we were in London, you know, getting assessed, and we were with Gordon Dutton, and it's been a very long road. But that aside, I think, you know, from one thing from today could be that, you know, if we just establish the numbers to begin with, we'd have a starting point with the likes of NCSE to make that, you know, make that start with them.
Make that argument. Okay, so Siobhan, I think what we will do after today, we will certainly be sending out a feedback form, I think, to get feedback from parents and to get some information, I suppose, like you say, that survey, or get maybe more specific information from you in relation to, and I suppose, as you say, have that numbers, you know, try use that as our evidence. We're kind of deciding where we're going forward. Erin, have you your hand up? Or sorry,
yes.
I think it's Marcella. Hi. Sorry, Marcella.
Hi, it's Marcella, her mum. Sorry, I couldn't log in on my own device. I just want to back up completely 100% what Siobhan is saying. I think it's critical and crucial that all SNAs should be involved. Just the point that a lot of children would have 3 or 4, we have 3 different SNAs in one particular day working with our child. As an example, that happens across the board. We can't change that with the NCSE because of the wording of accessing SNAs in the NCSE guidelines, and consistency gets lost. Secondary school is particularly difficult for children with CVI because they move from classroom to classroom, and you know, environments change. So what in primary school was workable, it gets completely lost in secondary school. And I think secondary schools need to be looked at by the NCBI. I know we have Victoria Elliott in Cork, and she's outstanding and has helped us a lot. However, we in Cork is a disaster area for ophthalmology, as everybody would know. We are now on 3-year waiting lists to see even an ophthalmologist here, which means we have to revert back to Dublin. I know Mayo is bad, Cork is extremely bad as well, but we seriously lack services down here. There is absolutely nothing in Cork, and I can't reiterate that anymore. We need assistance for the children down here, more assistance with schooling and with just daily living. Occupational therapy is a big gap there, and I just wanted to make that and to emphasize that point, because we're living with it since she was 4 years of age. She's now 16, and we are going to be transferring into an adult service, and we have no idea what happens after that. So I just wanted to make that point here, Eileen, that I know the children and young people are very important, but in our world, it's the speed at which things are rolling out. It just seems to be very, very slow for something that has been around for many, many years, which we went over to Scotland. We work with Gordon Dutton. I've heard all this so many times, but yet the action is very slow in coming. And that's no one's fault, and I'm not blaming anybody, but it is very, very slow. And we find that there's a disconnect between ophthalmologists and acknowledging CVI, whether we're on the right pathway or not. But we're coming from a brain tumour world, and I work with a lot of parents with brain tumour kids, and 80% of those children are left with CVI, but we're in the wrong pathway, and we can't cross over into CVI world because we're complex. And the more complex you become, the harder it is to get services.
Okay. But
we actually have absolutely nothing down here. So just wanted to make that point for people to hear, because some children are running out of time.
Okay, Marcel, and I appreciate you saying that, you know, and I suppose we will. I'm acknowledging, you know, that your daughter is 16, I suppose, and you're maybe referring to kids earlier on in the system. But I think absolutely, I think if we can get some more information, specific information from people, then obviously it's easier to go and to fight for something. So okay.
I'm dealing with like our NCBI's advocacy team, so they're there as well to support. Just to mention that, and also FAOC as well as another parent support group that people might be able to get some information there from as well. Just
and I think,
sorry.
Sorry, I was just going to say as well, if people can, you know, put these points into the feedback form, because we will be going through the feedback forms and looking at them. We want this information because we want to, you know, provide the service that parents and children need. So please, you know, just take a bit of time, put it into the feedback form, and don't feel that the feedback form is just kind of coming in and being, you know, left there. We will actively be looking at them and I know there was a couple of parents who wanted some contact from the local worker, and we will absolutely follow up on that as well. Okay.
Thanks, guys. I think if anyone has any other questions, I'm conscious of the time, so I don't want to be keeping people here. So I might just thank everybody, if that's okay. Just to say a special thank you to our speakers, to Sarah, Emma, Martina, and Aileen. I think from the chat and the group discussions, everybody has taken something from your talk. So a massive thank you. I was going to share some results on the polls, but I think I like the main thing I want to say is that group, that would people be interested in the parent support group, and I think nearly everyone said they would be. So we'll definitely be following up with that, guys. And like that again, I'm going to be sharing a feedback form now in a couple of minutes that I'll ask you to fill out, and if you just put down your name and your email so that we can follow up with information on that. And just to remind you again to email us in these questions and to let us know so that we can follow up with you guys. I also want to just do a special thank you to Martina, our speaker today, because we know how hard it is to get up and to talk about a topic, but to speak in front of everyone about something personal to your own experience, Martina, that's just to say a massive thank you for sharing that with us. I know the parents enjoyed listening to you, and for sharing your experience was very helpful to us, so thanks again. Also, I want to just say a big special thank you to Martina's husband as well, Hughie, and his workforce, Medtronic in Leitrim, who kindly donated to NCBI, and with that donation it enabled us to organise this conference today. So massive thank you to Hughie and to Medtronic in Leitrim as well. I just wanted to bring them in there.